Hospitals and long-term care facilities operate in a state of constant motion. At the center of that environment are nursing assistants, the professionals responsible for the everyday, essential, and high-pressure tasks of direct patient care. Stepping into that clinical reality requires compassion, certainly, but clinical safety also depends on a technical foundation of rigorous, federally regulated medical training. Welcome to edumatch.university. I'm Anita Johnson, your lead instructor for the 2026-2027 Nursing Assistant Certification course. Over the course of this program, we will build your competence from the ground up. You will learn the exact science of the human body, alongside the principles of holistic care, earning your place as a certified medical professional. Your journey begins with a streamlined digital enrollment. Once you meet the standard admission requirements, your access to the academic session begins immediately. This roadmap outlines the 4 to 6 months of study ahead of you. You will navigate through a hybrid curriculum, using both our digital learning management system and mobile applications to progress from foundational theory into clinical skills and finally toward certification. Initiating that first block of foundational theory immediately generates your active digital student ID, officially marking your entry into the university network. By placing the entire preparatory curriculum into a secure digital gateway, we remove geographic barriers. You have access to a comprehensive medical education exactly where and when you need it. Looking at this 3D wireframe, we start by isolating the core physiological systems you will interact with daily. In our digital classroom, you study the precise mechanics of the musculoskeletal, cardiovascular, and respiratory systems. You will also learn the specific medical terminology required for this environment. Accurate charting and clear communication with nurses and doctors depend on a shared, standardized vocabulary. Alongside the science, we cover the strict legal frameworks that govern patient care. You study ethical guidelines, patient rights, and the exact confidentiality protocols required by laws like HIPAA. Without internalizing both the anatomical science and the legal boundaries of your role, providing practical care is impossible and legally dangerous. This theory is your blueprint. This digital charting dashboard shows the metrics you will manage during your physical training phase. You will learn the techniques for taking, monitoring, and recording vital signs. That precision applies to safety. You will study infection control protocols, breaking chains of transmission. Next, we move on to physical mechanics. We teach the specific body positioning and weight distribution required to safely manage patient mobility, including lifting and bed transfers. You will also learn the standardized protocols for protecting a patient's dignity while assisting them with daily vulnerabilities, such as personal hygiene, feeding, and nutrition. Before you ever touch a real patient in a clinical setting, you will practice and refine these physical mechanics through our interactive online 3D labs. Mastery of these mechanical skills, from safe transfers to infection control, is the primary defense against clinical accidents and preventable patient injury. Holistic care requires addressing a patient's psychological and social needs alongside their medical requirements. This closed-loop infographic maps effective clinical communication. You will learn to read nonverbal cues, practice active listening, and relay observations to the health team. We also dedicate modules to communication strategies for interacting with cognitively impaired patients, navigating the challenges of dementia care. True clinical competency is achieved only when you treat a patient's mental and emotional state as rigorously as you treat their physical condition. After 4 to 6 months of structured study, you reach the final phase of your journey, proving your clinical competency through comprehensive testing. These final exams require you to pass both a secure, computer-based knowledge assessment on medical theory and a hands-on practical test of your physical clinical skills. This progression chart shows how completing the EduMatch Prep certificate provides the foundational credentials required to register for official board exams. Because certification is governed by law, you must carefully follow the specific testing and licensing requirements dictated by your localized regional regulatory authority. Passing those dual hurdles transforms you from a learner into a legally recognized essential healthcare worker, a position with immense value and high job security. The medical curriculum you are about to undertake is highly demanding, but by following this structured digital pathway, we have made it achievable. Your first step is simple. Visit the EduMatch Online University website to submit your enrollment and access the Learn LMS and mobile app today. Building a verified career in healthcare starts with meeting the standards of your local regulatory board through the right education. I look forward to seeing you in class.